Hello, my name is Martin Lipscomb, and in this conversation I'm joined by Professor Eleanor Bradley. Eleanor is Director of Research and Knowledge Exchange for the College of Life, Health and Environmental Sciences here at Worcester University. I will ask her in a moment to describe what this role is and involves. However, before posing this question, I'd like to know that Eleanor is by background a health psychologist, and moreover this background clearly informs a great deal of her ongoing activity. Thus, to highlight just a smattering of recent work, she has been involved in research looking into quality of life assessment, user involvement in mental health service provision, postnatal depression, decision-making in mental health, and mental health stigma. I could go on nonetheless. Without further ado, Eleanor, thank you for being here today. Please, could you describe your role here at Worcester? What does a Director of Research and Knowledge Exchange do? And also, could you give us an overview of health-related research activity at Worcester?
Absolutely. Thank you, Martin, and thank you for inviting me to do this today. It's a pleasure. So, what does a College Director of Research do? That's a really interesting question. As with many academic roles, it's a very wide-ranging role, lots of variety involved in it. Quite a lot of the planned activities that I have change at quite late notice. I'm required to be quite responsive to colleagues, but essentially the role is to support academic colleagues and our students with research and knowledge exchange activities across the college. And the college, for those who don't know, comprises our School of Nursing and Midwifery, Allied Health and Community, but also Science and the Environment. So the role brings with it lots of interdisciplinary opportunities for research, but also some challenge in that some of the things that we're interested in can, on the surface, look quite different and sometimes quite disparate. So my role really is to think about how we can engage with colleagues and students across those three different schools, how I can help colleagues facilitate their research activity, and ultimately really make sure that we conduct the best quality research that we can at the University of Worcester, and we have some fantastic track record in relation to that. On a very practical level, I'm very involved with PhD supervision, and I'm the chair of our Research Degrees Board, so I'm keen that we support our doctoral students as well as we can. And on a very practical level, I'm organising our submission to the Research Excellence Framework at the moment, so there is some fairly extensive paperwork involved and in a remote way of working, lots of emailing and a little bit of nagging at the moment. So that's predominantly what I'm involved with. One of the main advantages of my role is that I get to see the wide range of research that our colleagues and students are engaged with across the college. And despite some of that variety, actually there's a lot of research underway that certainly our nursing midwifery students would be interested in knowing about. We have organised our research across the college into groups. So we have research groups in each school. They range from a mood disorders research group, which has the largest population of participants diagnosed with bipolar disorder in the world there for the team to be doing research with. So some fantastically impactful work there. Your students and colleagues may well know about the Association for Dementia Studies, another internationally renowned research centre, very interested in person-centred approaches to dementia, and lots of links there with areas of nursing interests. We have a biomedical group, pollen and aerobiology research, sustainable environment research, and in the School of Nursing we have a very new research group which is designed to look at philosophy and ethics of professional practice. So the research we do isn't just limited to applied research where we're collecting data. There's other areas of really interesting research to be done around theoretical thinking. You know, what is nurse education? How does nurse training look in terms of our pedagogy? So a great range of research for students to be engaging with. And we've got quite a number of PhD students as well doing research in similar aligned areas. One of our students, Jo Johnson, is a health visitor by professional background, and she's looking at how health visitors and midwives support high-risk women in the perinatal period who may be at high risk of puerperal psychosis. So some fantastically interesting applied research. We have other students looking at music and dementia, shared decision making for those with rheumatoid arthritis, end of life care. There's a huge range, Martin, and there's lots and lots that students could be interested in hearing more about.
Okay, we do a lot then at Worcester, and in my experience, most nursing students, unfortunately, I think, have little or no idea of the scale and the nature of the research activity that collectively we're involved with. Now, I could be mistaken, however, if I'm right, if this aspect of university activity is effectively invisible to nursing students, is this important? Is it a problem? And if it is a problem, what perhaps ought to occur?
I think that's a really interesting issue to raise, and one of the key challenges that we have within the university, but within universities more broadly, is how best to promote and disseminate some of the research that we're doing, and how to promote that research to students who are doing courses that have a very busy curriculum, where the time that they have available is sometimes constrained because of all the various training and skills and different activities that they're engaging with. Those who are on work placement and are based outside are also, find it difficult to be on site to hear about these things on a regular basis. So I think it's a real challenge. I suppose what I would be saying is that we do have lots of opportunities where students can come and hear more about the research we do through some of our routine activities. The challenge is encouraging our students to feel that those activities are open to them, which they are, but also having our academic staff remind students that these are activities that are important and also open to them. So some of those activities might include our research seminar series. We also welcome students who want to attend those presentations of research. I think it's fantastic when academics teaching on courses talk about the research that they're doing themselves that relate to the topics and the areas that they're considering. I think we need to think about what we mean by research-inspired teaching and helping students understand that a session that they're engaging with might not be badged as research, but there's a high likelihood it will be inspired by research in lots of different ways. And so there's loads of different things, I think, Martin, that people can be doing to just remind all of ourselves that research is an absolutely core and fundamental part of our university education, regardless of the course that students are taking.
Okay.
If they have particular interests, we have various forums, and I would like to mention Teresa Mitchell, who's the Associate Professor of Nursing within the school, who runs a really exciting Research Secondment programme specifically for nurses and midwives. So if students are interested in hearing more about that and opportunities related to that, then they would be very welcome, I'm sure, to contact Teresa directly to ask a little bit more about that.
Okay. Let me ask another question, building slightly on what you've said. It's frequently claimed that research is a key component or facet of university education. And indeed, for many people, research is in large measure one, if not the primary raison d'etre underpinning university life. Further, personal engagement by students and faculty in research is often considered necessary for the development and maintenance of expertise in whatever discipline is considered. So let me ask, what do you think about those claims? And if nursing students are unaware of research at Worcester, what does this say about engagement of the type just described?
And I think that's another really interesting question, and it's a question that I get asked not only in the university, but it's a question often that I'm addressed with in our NHS organisations who are looking at how to engage their clinicians with research and what that means and what that could look like. I suppose I would agree that research is a fundamental underpinning of a university education. I think where there is a challenge sometimes, it's in that definition of what we mean by research active, research engaged. And I would say without doubt that all our nursing students, midwifery students need to be thinking about how they can engage with evidence-based clinical practice, how they can be sure that their practice is contemporary, that they are able to engage with a research literature that is ever expanding and ever complex, and think about what some of those core critical research activities might be. I would never have thought earlier in my career that I would have focused so entirely on research activity, because I found through my degree research to feel like quite an intimidating thing to be doing. And I think probably one of the barriers to becoming more research active and engaged is that the best way of learning about research is doing it. And getting rid of this conception that for research to be meaningful and impactful, it has to be large scale and international. I think actually some of the most impactful research to people's practice can be quite small scale and sometimes unfunded. So I think opportunities for nursing students to think about what kind of research they'd like to be involved with, what extent they would like that involvement to be, is really important, because a really good literature review can be as valuable as another piece of empirical research project work, particularly at the moment when quality appraisal is so important when you read publications. We need to know what's good research, what to use to inform our practice, and what's maybe less good research, what's more dubious. And there's never been a time in clinical practice when nurses and other healthcare professionals have had more opportunities to get involved with research within NHS organisations. Our National Institute for Health Research now offers multiple opportunities for nurses to support recruitment to research studies, to offer patients and carers opportunities to get more involved in research. And there are more opportunities for nurse research careers now than there have ever been. So I think a lot depends on how we define research, what we think it means, and having opportunities to discuss what research might be open to us to enable our own professional development, as well as our clinical expertise and our clinical and professional development.
Okay, thank you. Thank you very much for outlining your role, saying something about research at Worcester, and thank you for your time, Eleanor.
My pleasure. Thank you, Martin.
Cheerio.